Hello, my name's Alison Brunier, and I'm pleased to come to you today from the World Health Organization in Geneva. And today on this Facebook Live, we'll be talking about COVID-19 and older people. And I'm delighted to have with me today as our guest, Alana Officer from WHO's Team for Democratic Change, Demographic Change and Healthy Aging. Hello, Alana.
Hi, Alison. Lovely to be here. Thank you.
So during today's show, we'll be talking about COVID-19 and older people. We'll be talking about how COVID-19 is affecting older people, particularly the over 60s, how older people can protect themselves from infection, how they can stay physically and mentally healthy during the pandemic, and also how to continue contributing to families and communities during the pandemic. If you'd like to ask your questions to Alana, please do so. Send your questions onto the Facebook comments page, and we'll be happy to take your questions. But maybe before we do that, let's just start off with a first question for Alana. So Alana, can you tell us how has COVID-19 affected older people?
Thanks, Alison. During the pandemic, when we hear older people referred to, it's as if they're all the same, all frail, all vulnerable, all in need of protection. But this couldn't be really further from the truth. So you've got a lifetime. Older people have a lifetime of experience, which makes every older person really unique. Some older people have sort of the capacity of a 30, 40-year-old, whereas other people who are 60 and above require support for some very basic activities of daily living. Older people also have very different networks and resources in terms of their family and their financial resources. And it's really because of these incredible differences that their experience also of the pandemic has been very diverse. So some older people have really struggled to get access to the most basic needs: food, medicine, money, their pensions. Some older people living alone have experienced increased loneliness and social isolation. The large amount of information that older people and everybody else have been receiving also has created more anxiety and concerns. People with chronic conditions have reported finding it very difficult to get access to medicines and ongoing care. But it's not all negative. I mean, in many contexts, COVID has created a situation where it's strengthened family and community ties, where older people have started to learn new skills, might be in terms of, access to social media and improving their IT skills, but also have continued to contribute incredibly as they did before the pandemic. There's a great example in Ireland very early on in the pandemic, where there was a call for retired doctors and nurses. And within 3 days, 24,000 people came forward offering their support. But I think, your question was, how have they experienced it? I think everybody should be, if they've got parents or grandparents or older neighbours, they should ask them themselves. Today would be a good day to start.
A good introduction to this important topic, Alana. Evidence suggests that in terms of infection and disease, COVID-19 has disproportionately affected older people. What does this actually mean?
Yeah, good question. So COVID-19 affects people of all ages, yeah? But the evidence suggests that people 60 years and older are more likely to experience severe illness when they're infected by COVID-19, and therefore have a higher risk of dying as a result of COVID-19.
Just a reminder for those of you listening in today, you can ask your questions on the comments section of our Facebook page. You can also ask your questions through our Twitter account with hashtag AskWHO, or indeed on our LinkedIn page in the comments section. So we look forward to receiving your questions. Alana, just if we go back to basics, the main ways of preventing infection. So for an older person, what are the main things that I can do to protect myself against COVID-19?
Yeah, really important, Alison. So, I mean, there are 5 major things that I think that people should be doing, yeah? And many of you possibly know these, but it's really good to be reminded of them. So, wash your hands frequently with soap and water and dry them really thoroughly, or with alcohol-based rub. First one. Second one, cover your mouth and nose, in a flexed elbow or using a tissue when coughing and sneezing. 3, avoid touching, your eyes and your nose and your mouth. Really important to try and avoid the transmission of the virus. We need to clean and disinfect surfaces that we're touching frequently. So we need to clean those really regularly. And we need to keep physical distance, yeah? So we need to keep, WHO recommends, a metre from other people and between yourself and other people. And remembering that physical distance isn't social distance. So we just want the physical distance, but we want to stay connected. And I would say a 6th one, if you are asked to wear a mask, wear a mask. Thanks, Alison.
Okay, thanks a lot. One of the things you mentioned there, Alana, was the importance of staying socially connected. And of course, this is one of the things that we've all been confronted with from the beginning of this pandemic. And that's how difficult it can be to stay socially connected when there are physical distancing measures in place. And with the social isolation that sometimes has resulted from the physical distancing measures, this has led to loneliness and people feeling as though they're out of touch with family members. What are things that older people can do to stay mentally healthy as well as physically healthy during this pandemic?
You're completely right, and I think one of the key things is obviously staying socially connected. And that was the point also about, we can remain physically distanced but still socially connected. So it's really important to speak to your loved ones every day. You can do that by telephone, by video calls, by messaging, by writing, by sharing photos. And it's really important to maintain that connection. But there are lots of other things that we can do in our homes and communities to remain healthy. Keeping regular routines is actually really important. So getting up, getting dressed, sleeping, the activities that you do. Being physically active is essential. So trying to not sit for too long periods of time, doing, if you can, based on what your doctor might have suggested, 30 minutes a day of physical activity, making sure that the activities you choose are safe for you, drinking lots of water, especially in those countries where it's experiencing heat at the moment, and eating well and having a really balanced diet, avoiding smoking and alcohol consumption is really important. Taking breaks, there's so much information out there. So, taking breaks from the incredible amount of information that we're receiving is really important. I would say there's maybe 3 other things that we should be doing as well. So if you have an ongoing health condition, make sure that you continue to take care of yourself, to take your medications and follow the treatment regimes that you've agreed on with your doctor. If you have an emergency health condition, please seek treatment. Ring the hospital, but actually actively seek treatment. And if you're sad and worried and stressed, this is a really difficult time for many people. Seek some support. Seek care.
Okay, thanks a lot for explaining how older people can keep mentally healthy during this pandemic. So we now have questions starting to come in. Thank you very much for sending those. First question is from somebody who says,